So some stuff that we could look at for, say, hip flexion. If somebody's coming in and say when they're in a standing position, hip flexion is difficult for them, or they maybe can only get their hip up so far. Doing some really simple stuff like just having them sit on the edge of the table and lean forward is actually the same as hip flexion, but all the work is coming from the low back. Works really well for lumbar flexion or hip flexion to do the same thing. So a couple things that you can do is just have them kind of plant their hands, and then they're just going to slide their hands down their shins and come back up. So you're getting a little bit of graded exposure for lumbar flexion, but also for some hip flexion. And then if you want to ramp it up a little from there, once they get comfortable, so even if they can go part way down their shins, and then think about just like grabbing really tight, or directing them to grab really tight onto their shins, and then just standing up and staying in that same position. They're getting both lumbar flexion and hip flexion out of that. And it can be also just as simple as, why don't you just like grab your knee and bring it up to your chest. So maybe they can only get to here, and then you just tell them, okay, just drop down, let it go. Now I want you to think about just getting to the edge of where it feels uncomfortable again, and just push a little bit into it. Then let go, and just gradually keep pushing into the edge of that little bit of discomfort. Really simple way to just help people with hip flexion.